Okay, let's unpack this. The world of abdominal organ transplant surgery in 2024 and 2025 has truly been, well, pretty wild.
Yeah.
We've seen developments that almost nobody predicted, really reshaping what's possible and, challenging long-held assumptions. We're talking about black swan events, those incredibly rare, unexpected things that just have a massive, sometimes game-changing impact.
Exactly. And what's fascinating here, I think, is how these rare events aren't just like one-off curiosities.
Right.
They actually represent significant fundamental shifts. It could be unforeseen complications that force everyone to rethink things, or maybe extraordinary clinical cases that push the boundaries, or even genuine, surgical breakthroughs. They really redefine what we thought was possible, specifically for abdominal transplants, liver, kidney, pancreas, intestine, all that.
That's exactly why we're diving in today. Our mission, really, just to look at the most surprising and impactful recent stuff. We want to pull out the key takeaways from, well, a whole stack of reports, case studies, expert comments, and show you why it all matters. Think of it as your shortcut to understanding this field that's changing so fast. Get ready for some pretty astounding information. So if we're talking about pushing boundaries, maybe the most stunning development, the one that really caught everyone off guard, was in xenotransplantation.
Oh, absolutely.
I mean, using animal organs in humans, that's long been almost science fiction, right?
Right.
But late in 2024, surgeons at NYU Langone, they actually did it. They transplanted a genetically engineered pig's kidney into a human recipient, Tawana Looney, under compassionate use. What made this particular case just so, well, unprecedented?
Well, the success was truly remarkable. I mean, this pig kidney, it started working immediately.
Wow.
And crucially, it kept Ms. Looney healthy for over 2 months, 61 days post-transplant.
61 days.
Yeah. That made her the longest living human recipient of a pig organ, way past previous records, which were all under 8 weeks. And the reports confirmed her kidney function was, and I quote, absolutely normal. It wasn't just working, it was working well.
That is extraordinary. It really does sound like sci-fi becoming reality. What was the key? Like the scientific breakthrough that allowed this when other attempts hadn't gone so well. And what does that actually mean for tackling the organ shortage?
The key is really in the genetic modification of the pigs. Scientists can now edit multiple genes very precisely,
Okay.
making the pig organ much more, let's say, human-like, reducing those immune incompatibilities. And this specific success, it's been a massive morale boost for the whole field.
I can imagine.
Yeah, and it's definitely speeding up plans for formal clinical trials of pig organs, probably starting sometime in 2025. And the FDA, regulatory bodies, they're watching every single step very closely.
Right.
Dr. Robert Montgomery, who led the surgery, he put it really well. He said, seeing a patient walking around with a functioning pig organ and appearing completely healthy is extraordinary.
Yeah.
So the real aha moment here isn't just that it worked for 61 days. It's that it forces everyone, regulators, researchers, to fast-track what seemed like a far-off dream. It changes the whole game for getting organs.
And, as if that wasn't mind-blowing enough, I read about something really interesting with organ preservation, too.
Ah, yes.
For decades, it was always pack it on ice, rush it to the OR, basically suspended animation.
Right, the cooler box.
Exactly. But that seems to be changing, like, radically.
It really is a profound shift. We're seeing much wider use of normothermic machine perfusion, NMP.
NMP.
Okay. So since 2024, places like MUSC, the Medical University of South Carolina, they're routinely using devices like the Organox Metra. And this machine, it pumps warm, oxygenated blood and nutrients through, say, a donor liver. It keeps it basically alive and working outside the body.
Wow. So it's not just cold storage anymore.
Not at all. And this extends preservation time hugely, from maybe 6-8 hours on ice to 10-12 hours, sometimes more, which is massive logistically. And it lets surgeons actually check if the organ is viable, see if it's making bile, for example.
So they know it's good to go.
Exactly. MUSC did 5 successful liver transplants with this device in just a few months. Dr. Tracy Rice at MUSC said, this tech lets them preserve and test the viability in a way they never could before.
That's incredible. So less guesswork, more certainty. And they've taken this concept even further, haven't they, with something called extracorporeal pig liver support.
Yes, that's another fascinating development.
My understanding, late 2024, the idea was proposed. Use a gene-edited pig liver outside the patient's body. like a biological dialysis machine for the liver.
That's exactly it. And in April 2025, Agenesis and Organox actually got FDA clearance for the first human trial of this.
Already? Wow.
Yeah. So the system, it involves temporarily connecting this special genetically engineered pig liver called EGEEN 5784 to patients who have acute on chronic liver failure but aren't eligible for a transplant right now.
So like a bridge.
Exactly. The hope is the pig liver can stabilize the patient, maybe let their own liver recover, or just buy time until a human organ is found. It's already been tested, shown feasible in 4 brain-dead donor studies.
Okay.
And the potential is huge. It's described as a potentially life-saving technology for, the estimated 35,000 people in the U.S. hospitalized each year with acute liver failure.
That's a lot of people.
It is. And if you connect this to the bigger picture, the insight isn't just about buying time. It's this shift from, like you said, cold guesswork to real-time assessment and even external support. It means organs previously considered marginal might become good transplants. It really could revolutionize supply and success rates. It kind of blurs the line between transplant and critical care.
It's amazing how fast these experimental ideas are becoming, well, almost mainstream tools.
It really is moving quickly.
Beyond the tech, though, just the sheer audacity of some surgeries feels like a black swan event, too.
Yeah.
Like in February 2024, Cleveland Clinic did a triple organ transplant. Lungs, liver, and kidney, all at once.
Yeah, quite something.
On a 64-year-old man with a condition called alpha-1 antitrypsin deficiency. And apparently it was the first time ever for this specific condition.
That's right.
And before this case, only 3 such triple transplants had ever been done in the U.S. for any reason. What does that even take logistically, surgically?
Oh, the complexity is immense. I mean, this particular patient, he'd actually been turned down by other centers. He was just seen as too difficult.
Understandable.
The surgery itself took 2 days, using organs from one single donor, which highlights incredible coordination.
2 days. Wow.
And what's truly remarkable is his recovery. Discharged after 6 weeks, good health. They called it an excellent outcome, despite the sheer magnitude of the surgery.
Incredible.
Dr. Kenneth McCurry, one of the surgeons, emphasized that only a few centers anywhere can do this. It needs very skilled programs and just massive teamwork. So yeah, it really expands what's possible for patients with multiple organs failing and pushes other centers to maybe develop protocols for these super rare, life-saving operations.
It really is a testament to what teams can achieve.
Mm-hmm.
And speaking of expanding possibilities, transplant surgery is also merging with cancer treatment in some pretty unexpected ways. In September 2024, Vanderbilt did its first simultaneous liver transplant and a Whipple procedure.
Right, the Whipple, major surgery.
Yeah, on a patient, Reginald Porter, who had aggressive cholangiocarcinoma, that's a rare bile duct cancer that had already spread into his liver. What was so significant about combining those 2 massive surgeries?
Well, what's really fascinating here was the decision happened during the operation unexpectedly.
Really, mid-surgery.
Yeah. During Mr. Porter's liver transplant, the surgeons realized they also needed to do the pancreaticoduodenectomy to get all the cancer out. And instead of, stopping and planning for later, the Vanderbilt team just went ahead and did both right then in one marathon session.
Wow, that's gutsy.
It is. Dr. Martin Montenovo, the transplant surgeon, he noted, after liver transplant, the Whipple is the biggest abdominal surgery you can do. He had basically 2 of the biggest abdominal surgeries that a human can have.
Unbelievable. And the patient.
He recovered remarkably well. Cancer-free, healthy liver. It's this kind of fight fire with fire approach. It really opens the door for certain patients with both organ failure and these abdominal cancers that were once considered untreatable. It expands who might be eligible for transplant in oncology.
That's fantastic news for patients. And it sounds like the care was amazing, too.
Yes, Mr. Porter himself said, "I've never been treated so good in my life. They let it be known they were there to help me," which says a lot.
It really does. Now, shifting gears a bit, intestinal transplants, they're much less common, right? And
yeah.
Notoriously difficult.
Extremely rare, yes. And very challenging immunologically.
But there was this recent case, Danielle Perea, that really highlighted how life-saving they can be, even against terrible odds. Back in 2020, she was only 24, suffered catastrophic intestinal loss from a blood clot. They gave her hours to live.
Devastating situation.
Against all odds, she got a small intestine transplant at Cleveland Clinic. And by 2024, her story was making news. How rare is this, really? And what's changed to make successes like hers more possible?
It's incredibly rare. Only 95 intestinal transplants were done in the whole U.S. in 2023.
95, that's it.
That's it. The small intestine is just notoriously tricky for the immune system, very prone to rejection. But the good news is 1-year graft survival has improved quite a bit. It was around 76% back in 2018. Now it's up to about 82% in 2022.
Okay, that's a decent jump.
Mostly due to better surgical techniques and more refined, more targeted immunosuppression drugs and strategies. Now, Miss Perea, she did endure complications, which is pretty common with these complex transplants.
Right.
But 4 years later, she lives a relatively normal life. She eats, she got married. She jokes that, okay, aside from taking 40 pills a day,
30 pills.
yeah, but she says, there's nothing stopping you.
Amazing resilience.
It really is. And her case changes expectations. It shows that an intestinal transplant really can save young patients who literally had no other hope. It offers them a real future now.
That's just incredible. An amazing story.
Yeah.
But of course, not all these unexpected events are triumphs.
Unfortunately, no.
Sometimes these black swans, they reveal unforeseen risks,
Right.
forcing the community to learn some hard lessons.
That's the other side of it, yes. The cautionary tales.
Let's talk about that darker side, the rare, unforeseen complications that force adaptation.
Well, one really chilling case happened in late 2024. Rabies transmission.
Rabies. Through a transplant.
Yes. A patient in Ohio contracted rabies from a transplanted kidney. The donor, it turned out, had been exposed but died without the classic symptoms.
So it wasn't picked up in screening.
Exactly. It went unrecognized. And tragically, the recipient died in January 2025. It's one of the only known cases of rabies transmission through a solid organ transplant anywhere in the world.
Oh my God. That's horrifying.
It is. The CDC confirmed the cause, which triggered a whole public health response tracing, giving preventative treatment to others who got corneas from the same donor.
So how does the transplant world even react to something like that? Rabies isn't normally on the checklist, is it? That sounds like a true once-in-a-career nightmare.
You're exactly right. Rabies isn't routinely tested for because it's just so incredibly rare. But this case immediately made transplant centers revisit their donor risk assessment protocols,
Oh, so?
prompting more specific questions about, say, recent animal exposures or unexplained neurological deaths in potential donors, even if the symptoms aren't textbook rabies. It's a stark reminder that no screening is perfect. Vigilance has to constantly evolve.
A sobering lesson indeed. And there was another rare complication mentioned too, right? Donor-derived kidney cancer.
Yes, another rare but dreaded possibility. There's a 2024 case report about a kidney recipient who developed renal cell carcinoma, RCC, in the transplanted kidney within about a year.
And it came from the donor organ.
The evidence strongly suggested it originated from a tiny, undetected tumor that was already in the donor kidney at the time of transplant.
How often does that happen?
It's exceedingly rare. The incidence is estimated at only about 0.2%.
Okay, very low.
Very low. But the issue is the immunosuppression drugs needed to stop organ rejection, they can sometimes allow dormant cancer cells to wake up and grow faster. So this case, it highlighted that even careful donor screening isn't foolproof. And when it does happen, it requires really individualized decisions.
Like what?
Like maybe doing a partial nephrectomy, removing just the tumor part on the transplanted kidney itself, trying to save the graft. These cases, as awful as they are, they directly feed back into refining donor selection criteria. Maybe being more cautious with older donors or looking extra closely at any suspicious spots on imaging. And it informs how patients are monitored after the transplant, too.
So even these terrible negative black swans, these incredibly rare risks, they actually force the system to get better. They become catalysts for change.
Absolutely. That's a key takeaway. Transparency and rapid information sharing are critical here.
How does that work?
Even these nightmare scenarios, they spur evolution and protocols. Info on these black swan complications gets shared fast through case reports, registry data, conferences. This allows doctors all over the world to learn and implement safeguards. Like after the rabies case, UNOS and the CDC put out alerts immediately, reminding programs about subtle risk factors for encephalitis in donors. So every single one of these unique events, good or bad, ultimately contributes to making transplants safer, more reliable. The field is constantly improving because of them.
So pulling it all together then,
Yeah.
what does this all mean for the future of organ transplantation? I mean, 2024, 2025, clearly a time of huge change in abdominal transplants. Incredible wins, but also some really sobering challenges. from pig organs working in humans to these unbelievably complex multi-organ surgeries, brand new ways to keep organs viable. We're really seeing the limits push outwards, right? Offering hope where maybe there wasn't much before.
That's exactly it. These rare events, whether they're amazing breakthroughs or unexpected complications, they're doing two things at once. They're prompting much greater vigilance, more careful checks, but also driving audacious innovation. The field is learning, constantly adapting, responding. That leads to better screening, better monitoring, and sometimes, like we saw, complete new surgical approaches. It's a very dynamic landscape right now.
Yeah. It feels like these black swan events, as unlikely as they seemed maybe just a few years ago, they've really kicked off a new era.
Yeah.
One that's both more cautious, maybe, but also much more daring in transplant medicine.
Well put.
The field really does stand transformed. It feels more innovative and adaptable than ever before. So as you reflect on this deep dive, maybe consider this. What other areas of medicine might be on the edge of similar kinds of unexpected game-changing shifts? And what unforeseen challenges could they bring to light?